Yes, and we're also honored to have Professor Gamzu and Kroner in the field, and they're going to be here after the conversation with the startups on stage. I would like to start with something that I feel is very important to say on this very day, Conference of Restart Israel in Berlin. The bigger game than the game of war is a game of hope. This conference is about hope. When we fall like seeds, and there's no better industry to give away, create, innovate, and save us and into the future with brilliant ideas that are all about hope for patients, for physicians, for ourselves. And it's my honor to invite to stage the first presenter who is actually not the CEO of EasyBra. The CEO of EasyBra is right now with pneumonia, but one of their biggest investors and chairman of the board, Ancheen Blackpool, drove 7 hours from Amsterdam to be here with us today. So please come over. Take the second seat. Yes. Yes, I would like to call the CEO of Revital, Mandil-Levin, the founder of NanoCarry, to the stage. NanoCarry does biologics beyond boundaries, and we'll hear more about it. I would like to call Ofer Barshem, CEO of Cell Lipo. Yes, come over. Cell Lipo specializes in personalized fat stem cell therapy. We will call RealView Imaging, the COO, founder and president, Shaul Gelman, who happens to be an augmented reality rock star. And a lot of what he's done in the past is Air Force related, but now he does it for physicians. We'll hear more about him. And last but not least, Dr. Shira Doron, founder, CEO of Aviv. Great. So, Ancheen Blackpool, you're the first, and here is the clicker for you.
Thank you. What you see here is a wound dressing, perfect, right compression sterile for post-surgery breast of women. There's only, if you're a VC, only 17 million women every year that have breast cancer or have another operation on their breast. That's a small market, right? But in 5 years' time, that's actually 100 million women. And when they come out of surgery, there's no proper solution. Now, to make this easy for you, think of your neck. If you would have an operation on your neck, how would you do a proper wound dressing? Right? You have a bandage, it drops off. You can't stick it. So now think of it if you have two breasts, and one breast might be different than the other breast. They found a solution. And what they also did, which I think is really smart, they incorporated also to be a bra. So it's not only a wound dressing, perfect, right compression, sterile, the doctors love it, but it's actually something that the patient wants. And then you think, why didn't it happen before? Maybe because most of these people, the directors in wound dressing companies, are men. Maybe because most doctors are men. Maybe because the wound dressing industry is not caring that much about patients, but is thinking about units that they sell, and it's quite a conservative industry. So you have to be a little bit out of the box thinking, and that's the typical Israeli thing, but maybe you also need to be a patient that actually went through this. And this is why the product came about. Roman is the founder. And she actually had breast cancer and 4 more operations. And then after the 4th time, she said, this is it. We need to have a solution for women to recover in a dignified way. So that's what we see here, compression, absorption, adhesive, sterile. And very important, after you have a breast surgery, you can't lift your arms. So you need somebody else to replace the bandage for you. And they actually created a solution that you can do yourself as well when you're back home as a patient. You can actually change it yourself. So, what are we looking for? Well, the company is now growing really fast. If you talk about a restart, this is a restart. They already had a product in the market. It was produced in the UK. The UK factory was taken over by private equity. They like to make a lot of money, so they said, look, you're 2 small batches. Please find another producer. They did, and that's actually what the Catalyst Impact Investment Club that I'm the founder of. We invested together with VCs in Israel and in Berlin. We invested in the company to get the production up and running again. Since 2 weeks, they are selling in the US because we have the FDA for the US. In April, we will have the CE registration again. And this year, we'll be making 1.2 million revenue, next year 4 million, and the year after 10. So we're looking for a strategic investor or a financial investor. We're raising 3 million. And as I'm one of the investors, we will again invest. I'm looking for the right impact investor or family office because we're going straight to exit after this round.
Thank you so much, Anne-Clean
Yeah.
Blackpool. Thank you for coming all the way out here. Dr. Revital Mandil-Levin.
So my name is Revital Mandil-Levin, and I'm the CEO and co-founder of NanoCarry, and with me founded the company two exceptional co-founders.
Stand up.
Dr. Shira, the inventor of the technology, who spent over a decade of research at Bar-Ilan University, Faculty of Engineering, searching for novel ways to deliver drugs to the brain, and Professor Ochela Popovtzer. She is a world expert in the field of nanomedicine. Can we switch slides, please?
Now, Revital, just so before you go to the next slide.
It's me?
Yes.
The green. Oh, good. So what is the problem we are solving? So, in fact, there are more than 400 million patients in the world suffering from devastating brain diseases that cannot be treated by modern medicines, such as therapeutic antibodies, because they cannot enter the brain. Therapeutic antibodies is one of the largest and most important group of drugs with both clinically and commercially, with a market size expected to exceed 300 billion by 2025, and yet they cannot be used to treat brain diseases. And why is that? Because they cannot cross the blood-brain barrier, also known as the BBB, which is a protective layer on the brain blood vessels that blocks 98% of drugs and almost all antibodies from getting in. And this makes it one of the greatest unmet need in medicine. So let's imagine a patient with HER2-positive breast cancer. This type of breast cancer, metastatic breast cancer, responds well to the gold standard treatment, that is, two antibodies called Herceptin and Perjeta. That is, until it reaches the brain, which happens in 50% of metastatic breast cancer cases. Suddenly, these life-saving therapies reach a dead end, and survival rates plummet to 6 to 9 months. And this devastating solution is what we are tackling with our first product that we have already fully developed, tested it in animals, and we are now advancing into human studies. And how do we do that? We're doing that by using our Access bioengineered nanotechnology platform that is designed to carry up to 30 antibodies to the brain. And here is the deal. We are using non-modified, simple insulin molecule attached to our particles in order to enter the brain, because insulin is known for its ability to cross the blood-brain barrier, essentially tricking the barrier and shuttling the whole complex inside. So that's what we are trying to do. We already succeeded to demonstrate efficacy in animals, and we are now raising seed round in order to get our first product to first-in-human testing next year, and we expect approval in 2027. Why so fast? Because we are expecting an accelerated path of development due to the great unmet need and paucity of therapeutic options. I just really wanted to show you one scan of a brain so you will see our particles inside the brain, but it is probably not possible. Okay.
Yes, sorry.
So come to see me later. Thank you.
Yes. Yes, as the world is aging, your solution is definitely going to be super meaningful, given the fact that there's so many people are in.
And this is very important. We do not do any new biology, any new science. Everything is already established. This comes from the engineering faculty. So this is a new technology, not a new biology. Very important.
I'm so happy you shared that. Thank you so much. We're going to go to, thank you so much. A round of applause for Dr. Revital. And excited to introduce Ofer Barshem, who's here, cell lipo.
Okay, so thank you. I'm Ofer Barshem. I'm CEO and co-founder of Cell Lipo, where we are on the quest for the holy grail of regenerative medicine, nothing less than that. What we're trying to do is to harness the natural power of stem cells for our own healing. And that's probably part of a trend in medicine that we see today. We try to leverage on existing mechanism within our body in order to repair disorders, right? So personally, I have about 25 years experience in this field, and I'm lucky enough to be part of a group of experts. Our chairperson, Shai Zima, and then Dr. Nir Shani, formerly working in Ichilov Medical Center. We'll talk about him in a second. Dr. Nissim Darwish and Dr. Doron Shop, both are board members and experts in building new medtech companies. Dr. Ziv Karni, he's a world-renowned inventor of medical technology, especially in the field of lasers, and he's our CTO. And then Professor Eyal Gur, who is a plastic surgeon. He's the one who envisioned everything that I'm going to show you today. So regenerative medicine, as I said, is all about leveraging on existing mechanisms. And we all heard about stem cells. So I'll give you the shortest lesson ever on stem cells.
It has to be short because we're very limited with time, but it's a very exciting thing, so why don't you...
Yeah, so just 3 facts. So stem cells are great for regeneration of tissue. They build tissue. Why? Because they differentiate and proliferate very fast. The biologists nod, so I'm good. And secondly, once you have a new tissue that you've created, you need to supply it with blood. So the second thing they do very well, they actually create blood vessels, tiny capillary blood vessels that then provide good nutrition, blood, to this newly formed tissue. And lastly, they reduce inflammation, something I'm going to come back to at the end of my short pitch. So stem cells are great, we all agree. Where do we find them? They're everywhere in the body. Luckily enough, our own fat is a great reservoir of stem cells. We have plenty of stem cells in the fat, actually 100 times more than even in our bone marrow. So the challenge is, how do you cherry pick those stem cells from fat? The technology we have today was developed for 7 years in Ichilov Medical Center. It's the major university center in Tel Aviv. We have the pleasure of having the CEO of Professor Ronnie Gamzo here with us. So it comes from his hospital. And this technology, so we are a young company within a rather mature technology. And what we are actually offering to the physician is a simple procedure where a patient comes into the clinic, and within 40 minutes, we harvest the fat, we collect the fat, we process it, and re-inject freshly harvested stem cells from the patient himself. So you ask yourself, what is it good for? Plenty of things. We've decided to focus on 2. First one is medical aesthetics. One of the people presenting before me has mentioned hyaluronic acid that is used as a filler, as a dermal filler. So dermal fillers are nice, but they don't stay long, and sometimes they stay nice on one side and on the other side less. So you get a terrible results or side effects. So we are going to overcome this by offering a natural solution that will stay longer. The second market that we're going to target will be orthopedics, mainly regenerative diseases like knee osteoarthritis, where I promised to say 2 words about inflammation, where inflammation is the biggest issue, and we know from science that stem cells can treat that. So in 40 minutes, all this procedure is done. My last slide is going to take 30 seconds. So we are on a very short runway. That's the reason why I joined the company and gladly took the chair of CEO, because I'm convinced that in 2 years, we're going to have the first product ready for marketing in medical aesthetics. We're going to be CE and FDA approved, and then look at orthopedics. And that's why we're financing the company with $4 million US. Part of it we've already secured, and I'm glad to say that some of our investors are leading surgeons and industry experts.
Thank you so much, Ofer. You pretty much covered it all. Shaul Gelman, founder, president, and COO of Realview Imaging.
Thank you very much. So my name is Shaul Gelman. Very happy to be here. Thank you for hosting us and for the organizers. And thank you, Netta, for introducing me.
Sure.
My background is from Elbit Systems. I've been working there for many years, developing augmented reality for pilot applications. Actually, Elbit is leading this world with 80% market share with friendly air forces around the world. So I'm proud to say that my programs are flying in many places. And the idea when we started off Realview was just like we were giving real-time information for the pilot to make decisions, we would like to give the physicians that are actually doing interventions and medical applications to have real-time information in front of their eyes while they are treating the patients. So this is what we have invented. We have invented actually the first system in the world that is creating real volumetric holograms. This is reality, optical reality, not optical illusions. You can look at our system. This is an electro-optical system that actually prints little points of light in space. We are doing it dense enough, and many thousands of them in real time. So actually the physician can, while treating the patient, see exactly the organ that is being treated, including the smallest details in the anatomy and the pathology. And most importantly, he can also see the tools that he's driving intraoperatively. So what you see here, this is the interventionalist in the cath lab, for example. The patient is beneath. The heart that is being treated right now is hovering in real time in space, and the physician that is holding the catheter can see the treated organ and actually understand exactly and intuitively what they are doing. So as you can see here, holography is the most realistic 3D modality that is out there. Many years you can only see holograms in museums, usually monochromatic, green, and static. So we took it all the way to dynamic images in real time. It gives you to really understand intuitively what you're doing. You can do natural in-image interactions, as you can see here. So anything you do on your smartphone, you can do in the hologram. By literally touch the hologram, you can rotate, slice, mark, measure, do anything you want with it. The system, we had several prototypes, and I had some meetings here with many people here when it was an idea. Eventually, the system that is now went all the way to a commercial system is to be part of the room and not part of the user, because physicians don't really like to put anything on their heads. Many times they already have something on their heads, and it's mandatory to have, for example, in the cath lab, radiation protection glasses, so you cannot use any headset. So what we have is a system that is above the physician, electro-optical system with a HUD. You can take down the system and then to see the hologram. You don't have to wear anything special. You can take it away. We have 40 patents around it, 31 already granted. And actually, if any of you used AR, VR, 3D movies, probably you have some headaches and things like that. In our system, you don't have any headaches because it's real holography. And if you think it's science fictional, well, we have FDA clearance and we have CE certification. We sold 3 systems, one just earlier this month here in Germany to HDZ, which is a big achievement for us. We have another system sold to New York Presbyterian, Columbia University in the United States, and we have one system in Israel in Schneider Children's Hospital. This slide actually makes me extremely proud because what you see here, these are the kind of procedures that our system was already used. So in these procedures, which are mitral valve interventions, left atrial appendage interventions, and other very complicated interventions. So people today are using three-dimensional information. What we do is actually intraoperatively show them holograms of the treated organ while they are treating it in real time. So we've been doing many dozens actually of procedures, which is very important, of course. Today, as a small company out of Israel, we are ultra focused on specific area, which is the catheterization laboratories. There are 15,000 3D-enabled cath labs around the world, which makes a $4 billion market for us, only for our system. Certainly, we're relevant for additional places because we can show the hologram inside the patient as if the patient is open, but actually is closed. So the patient is literally transparent, and you can do, for example, biopsy or deliver energy to a specific location without opening the patient, and other areas. To summarize, we have a leading team, both as management and board members. Shimon Eko is Dr. Richter, Kobi Richter, which probably Israelis know very much. We have a market-ready product, so it's not a prototype or something. We have an established sales and marketing management system. We already are managing 200 leads. We have all manufacturing capabilities, ISO certification. We have first 3 sales, which makes us very proud. And right now, we are actually expanding our previous round that we did a year ago with additional $5 million under the same terms as more than a year ago. Dr. Kobi Richter, actually the owner of Medinol, one of the big stent companies in the world, is actually the lead investor, and I'm very happy to meet any of you that is interested in investing in real view imaging. Thank you.
Thank you, Shaul Gelman. And our last presenter, Dr. Shira Doron, fascinating company. Please tell us about Alviv and what made you come all the way out here today.
Thank you very much. So my name is Shira Doron. I'm the CEO and co-founder of Alviv Laser Solution. Alviv Laser Solution is offering a laser-based outpatient, pain-free treatment for fecal incontinence patients, trying to change the modality of treatment and help them regain their quality of life. We are established in January 2023 and kicked off in March 2023. And I'm proud to say that when going back to Israel, we're going to kick off our first in-human study already in Meir Medical Center. We also, our preclinical results were chosen to be presented at the DDW, one of the leading gastroenterology conferences in the US because of its novelty. We have a working, of course, prototype and a PCT submission, so we're very proud at the accomplishment within 1 year. Our mission is to help mild to moderate fecal incontinence patients regain their quality of life, basically by treating the core problem and strengthening the internal sphincter of the body. Now, you would think that this is a condition that mostly very old people, institutionalized, are suffering from. But in reality, about 9% of the world population is suffering from symptoms of fecal incontinence. A meta-analysis in Europe have shown that about 10% of the population is reported to suffer from such episodes, from mild all the way to severe. And in the US, a survey have shown that every 1 of 12 people is suffering from the inability to control their body. What we are doing, we are using commercially available technology, diode laser, radial fibers. They're being used in gynecology, proctology, vein ablation, liposuction, and so on, together with a proprietary handpiece and a software that we have developed that is basically bringing the energy source to the treatment area, inducing collagen and elastin regeneration by heating under a temperature-controlled area. And this is borrowed from dermatology and gynecology. This is a well-known biological process that we are harnessing to treat the sphincter, the internal sphincter. This is, of course, has many benefits to both patients, no pain, no ablation to the tissue on one hand, and for the physician, it's a short and hopefully very safe treatment. The team comes from many years of understanding laser-based medical application development, and of course, understanding the clinical problem. The next step for us is to take the handpiece that we are using in the first-in-human, cost reduce it, optimize it, so we will hit the efficacy study with the same handpiece that is going to be used commercially. And of course, to open sites for the efficacy study. And by the end of the year, we hope to finalize the first-in-human study and start our discussion with the regulatory bodies, and hope to present the study in one of the biggest gastroenterology conferences in the world. We are looking to raise €1 million in order to hit those 3 targets: optimize the device and cost reduce it to fit the market, kick off the efficacy study, and of course to start the regulatory process.
Thank you very much, all the presenters.